Hi, let me introduce you to MONTREAL Cognitive Assessment. MONTREAL Cognitive Assessment or MoCA is a 30-point screening tool. It is administered in clinical care setting and community setting. MoCA is used to screen for cognitive function and assess for change over time. MoCA is developed by Dr. Ziad Nasruddin. The purpose of MoCA is to develop for detection of mild cognitive impairment and early dementia. It also to differentiate healthy cognitive aging from mild cognitive impairment. MoCA is performance-based assessment. The components being assessed in MoCA is conceptual thinking, calculation, memory, attention and concentration, executive function, language, visual constructional skills, and orientation. The target population is for people who age range 55 to 85 years old. The target population is for patients who has condition mild cognitive impairment, Alzheimer's disease, cerebrovascular condition, traumatic brain injury, HIV, psychiatric condition, Huntington disease, Parkinson disease, multiple sclerosis, Korsakoff syndrome, and substance abuse. For contraindication, this assessment is not suitable for individuals with aphasia or to be used with a policy respondent. This assessment takes 10 minutes to complete. There is administration and scoring for MoCA. For attended trail making, the examiner instructs the subject to draw the line from a number to a letter in the ascending order, beginning from 1, then A, and lastly will end at E. For scoring, 1 point is allocated if the subject draws the line correctly in ascending order. For the cube, the subject needs to copy the drawing accurately. For scoring, 1 point is allocated for each criteria is met. No point is given if the criteria is not met. Next, the examiner will ask the subject to draw a clock and then set the time to 10 after 11. For scoring, 1 point is allocated for each criteria, which is the contour, numbers, and hands, and the total for each criteria is 3 points. For naming, the examiner will ask the subject to name each animal. For scoring, 1 point is given for each following: first is camel or dromedary, second is lion, and third is rhinoceros or rhino. For memory, the examiner will read a list of 5 words at a rate of 1 per second. At the end of second trial, inform the subject that he or she must recall this word again at the end of the test. For scoring, no point is given for trial 1 and 2. Next, forward digit span and backward digit span. For forward digit span, the examiner will read the 5 number sequence at the rate of 1 digit per second. For backward digit span, the examiner will read the 3 number sequence at a rate of 1 digit per second. For scoring, 1 point for each sequence scoring repeated. Next, the examiner reads the list of letters at a rate of 1 per second and asks the subject to tap his hands once every time the examiner says letter A. For scoring, 1 point if there is 0 to 1 errors. For scenario 7, the examiner will ask the subject to subtract 7 from 100 and keep subtracting 7 from the answer until the examiner says stop. Give instruction twice if necessary. For scoring, 0 point for non-correct subtraction, 1 point for 1 correct subtraction, 2 points for 2 to 3 correct subtraction, 3 points for 4 or 5 correct subtraction. If the subject responds with incorrect numbers but continue correctly subtract 7 from it, give a point for each correct subtraction. For language sentence repetition, the examiner reads the sentence and the subject needs to repeat the sentence accurately. 1 point for each sentence correctly repeated. For verbal fluency, the examiner will ask the subject to tell as many words as he or she can think which begin with a certain letter or alphabet. The examiner will ask the subject to stop after 1 minute. 1 point if the subject generates 11 words or more in 60 seconds, and record the subject response in bottom or side margins. For abstraction, the examiner asks the subject to explain what each pair of words has in common. If the subject gives appropriate response, do not give any additional instruction or clarification. Give 1 point to each item pair correctly answered. For delayed recall, the examiner asks the subject to recall the words from earlier. Make a check mark for each word that the subject can recall spontaneously without any cues in the allocated space. 1 point for each word correctly recalled spontaneously without any cue. No point are given for words recalled with cue. This is example using category or multiple choice cue for each word. For orientation, the examiner asks the subject about the exit date, name of the place in which city it is in. For scoring, give 1 point for each item correctly answered. For total score, sum all sub-score listed on the right-hand side. Add 1 point for an individual who has 12 years or fewer of formal education. If a subject scores 30 over 30, a point is not added if he or she has 12 years of education or less. For interpretation, the total possible score is 30 points. A score of 26 or above is considered normal. If the patient gets 18 to 25, it means that patient has mild cognitive impairment. 10 to 17, it means that patient has moderate cognitive impairment, and less than 10, which means patient has severe cognitive impairment. Administration video. Assalamualaikum Puan Siti. My name is Nur Isna'Ajla binti Farinaha and I'll be a therapist today.
Waalaikumsalam.
So today we will conduct MONTREAL cognitive assessment of Puan Siti, and I hope that Puan Siti will answer all the questions that I will ask Puan Siti later.
Okay.
Okay Puan Siti, can you tell me the name of this animal?
Cat.
Okay, this.
Buffalo.
Okay, this.
Llama.
Okay Puan Siti, I want you to tell me the date of today.
16 January 2021.
Okay, now tell me what name of this place and which city is it in?
Bandar Tasik Kasima. City is Rana.
As the result of this assessment, Puan Siti get 19 over 30, which means she has mild cognitive impairment. Next is psychometric properties of MoCA. For reliability, MoCA has acceptable internal consistency and excellent test retest. MoCA also has a good interactive reliability. For face validity, MoCA has been tested extensively for use in variety of disorder affecting condition, and it has been tested in variety of setting and population and display accuracy in identification of mild cognitive impairment and eczema dementia. MoCA was shown to pick up more diseases in executive function, attention, and delay recall. MoCA was able to detect age-related cognitive decline across the adult lifespan. MoCA has good concurrent validity, and for conversion validity, MoCA score were highly and positively associated with mini mental state examination MMSE score. MoCA has excellent discriminant validity for mild cognitive impairment and eczema disease. MoCA has high sensitivity and specificity in detecting mild cognitive impairment and eczema disease. This is advantages of MoCA. And this is disadvantages of MoCA. MoCA is suitable to be used with mentioned population because the items in this assessment are relevant and appropriate to mentioned population. That's all from me. Thank you.